Hello, welcome to the fourth webinar in a series of 4 that Guiding Star Project has put out on natural women's healthcare. This final webinar was delivered by Kari Beadner, Certified Labor Doula and Executive Director of Guiding Star Orange City. The first minute or two of this presentation, unfortunately, the vocal recording was lost, so Kari's introduction is kind of cut short on this webinar. So I'm giving you a very quick overview to what Kari shared. Kari is a certified labor doula as well as a certified Creighton practitioner of fertility awareness. She is also a mother and has had a lot of experience helping women through the process of not only becoming pregnant, but then going through their pregnancy, labor, and delivery and welcoming the baby into their home. So she is a wealth of knowledge, and we are so honored that she would share her expertise with us here in this webinar. We'll pick up the recording where where the recording began. Kari is giving a disclaimer in which she shares that she is not a doctor or a midwife and that no part of the webinar should be taken for medical advice. With that, I'll hand this over to Kari.
Not all pregnancies are low risk, so each woman should choose the best care provider for her and her baby. And they should also consult that provider concerning anything for their personal health situation. Also, this is not a catch-all webinar. Birth is different for every woman, and there's no perfect location, care provider, time, or method for every birth. So many options are available and should be discussed by each woman and her chosen care provider. Finally, my last disclaimer is the fact that I do not deliver babies. In fact, women don't even deliver babies. Babies are not pizzas. They're born, not delivered. So with further ado, we will continue on with the webinar. The woman's body is amazing. Anyone who's been around a Guiding Star Center long enough, you may have heard that women are created with 3 superpowers. These 3 superpowers are that we are able to ovulate, gestate, and lactate. So think about this. The beautiful event of ovulation itself is amazing, and all of the steps needed for conception to occur in itself is a miracle. Then, if it wasn't enough that our bodies ovulate so beautifully and are the meeting place for the beginning of a life of conception, a woman's body then grows a built-in food source alongside the baby and moves all of the organs around to make room for this baby human to grow and develop until it's ready to be born. Then, as if this wasn't enough, that our bodies are made to grow people. I mean, really, we get to grow people. We actually have our pelvis shaped in just the right size and shape to give birth to a baby that just fits through it in just the right way to meet us. Then, once this baby is born, the woman's body isn't finished yet. We then continue on growing our little humans with milk from our breast, with no other supplements even needed until up to about a year. If you haven't had a chance to go back and listen to Leah's webinar about breastfeeding, please do. And also Molly's webinar about fertility awareness. The more we learn about our bodies and their natural functions, the more empowered that we're going to be in the way that we use our bodies and we care for them and the life that can be birthed from them. So with birth is physiological. It's normal and natural. It's a function of the woman's body. So no matter the location of the birth, the time, the environment, or who is present, a baby will be born. No woman has ever stayed pregnant forever. But it's amazing how I found myself in need of this remembrance during birth on a few occasions. Why does childbirth even matter? You might have heard some people say, as long as the baby is healthy, then birth doesn't matter. Or you don't get a prize if you birth your baby naturally versus having intervention. Well, I think I'd like to challenge this because I feel that birth really does matter. It matters deeply. There's this really big change that happens when a baby is born. There are natural hormones that flow from the woman, and this rush of hormones and the immediate responses for the mother and the child, who have actually coexisted for months, are now forever changed as they try to reestablish this bond on the outside while learning how to even breathe the same air. So it's a big deal. It's a big change that happens. And then again, why does childbirth matter? Because women matter. Women matter as they are the holders of life. Within our Guiding Star philosophy statement, there is a line that says this. It says, "We believe that life naturally begins at conception within women and requires a yes on the part of a woman to be realized. Therefore, women are at the heart of the culture of life." So the experience of childbirth is a pro-life issue, because if a woman is treated poorly when giving birth, if she experiences trauma or has a terrible experience, it may affect the number of children that she decides to have. It may even create a desperate need for her to never experience childbirth again. She may decide to take harmful abortifacient contraceptives, cut off her fertility with a tubal ligation or hysterectomy, or she may even choose an abortion. But for women who are supported fully, who feel safe and empowered by her physiological ability to birth life into this world, childbirth becomes the beautiful gift, life-giving experience that it was intended to be. So many women, after giving birth, feel so very empowered by the accomplishment that they feel that they can actually do anything. And I have felt this feeling several times. So this webinar is actually about natural childbirth. And natural childbirth, the actual definition of that is a vaginal birth without medical intervention. So there are many misconceptions about natural childbirth. There's misconceptions about the location that a birth could be, that in order for it to be natural, or even the type of woman who would be able to handle a natural birth. But the fact is that I believe that any woman who commits to a natural birth with a normal, low-risk pregnancy can accomplish that goal. And it doesn't matter, because a natural birth is not restricted by location. A natural birth can occur in a hospital, it can happen in a birth center, or a home birth. And there's not just one type of woman that can achieve a natural birth. Anyone can do it. So also, the natural birth is so important because of the fact that the baby receives good vaginal bacteria as they pass through the birth canal. In labor, natural oxytocin hormone is released by the mother. Now, oxytocin is released during lovemaking, orgasm, labor contractions, and letdown in breastfeeding. So the babies born during natural childbirth tends to be healthier, less stressed, and they usually have very good APGAR scores as well. These babies tend to bond more easily with their mothers, which is really important, as that is the time when we initiate breastfeeding as well. So we tend to have less challenges in that initial breastfeeding relationship as it starts. Postpartum recovery tends to be a bit easier after natural childbirth as well in that recovery, and then if we have extra medical interventions and the extra recovery that would be required in that situation. Now, the fact is that over 50% of babies are being born in an unnatural way in the U.S. I'm not going to go into all of the different interventions that are available for childbirth, because I think that there's plenty of education upon the different interventions that are available. However, I don't think that we hear enough about some of the effects of an unneeded medical intervention in childbirth. Now, some of the effects might include difficulty in bonding between the mother with that lack of hormonal support that might be there. And that might be also due to the fact that it will increase the risks of obesity, type 1 diabetes later in life for the baby. Distress during the birth can cause also long-term traumatic stress disorders. So for mom, the recovery might be even longer, or maybe a higher risk of postpartum depression, or the challenges in breastfeeding might be there as well. So I think it's important for us to think about how we are birthing and how we are treating people as they begin life. I recently read a quote, and the quote said, "If we hope to create a non-violent world where respect and kindness replace fear and hatred, we must begin with how we treat each other at the beginning of life. For that is where our deepest patterns are set. From these roots grow fear and alienation, or love and trust." And that's from Suzanne Arms. So that really matters. It matters how we are beginning life and how we are treating people from that point. So we've all probably have heard a few stories of birth trauma and injury, both to mothers and to babies. A therapist friend of mine reminded me that trauma is relative. What one person might feel as trauma might not be for someone else, but it is deep and it's real, and to that person because it happened to them. But there's good news. The good news is that there is hope and healing available for those who have suffered from birth trauma or injury. Emotional therapy and birth trauma support groups are helpful. At Guiding Star Cedar Valley, they have a peer-led birth trauma support group. Locally here in Northwest Iowa, we have therapists who are trained in EMDR. EMDR stands for Eye Movement Desensitization and Reprocessing. And this is a psychotherapy that enables people to heal from the symptoms and emotional distress that are the result from disturbing life experiences. So repeated studies have now shown us that by using EMDR therapy, people can actually experience benefits of talk therapy that once took years to make actual difference. So this is going to help us to be able to actually allow counseling and talk therapies to work better. So birth trauma may also affect babies, right? So this idea that we are beginning to learn more that the post-traumatic disorders that may be experienced by a person who grows up with uncared for birth trauma. We actually see that people who had trauma in utero can have triggers that cause stress to them later on in life, and that EMDR therapy can offer treatment to these people as well. And I think that is just fascinating. Also, writing out our birth stories can always be a good way to reflect in each birth experience. So if you've had a birth experience with medical interventions for any reason, or even if you've had experienced a natural birth, reflecting on your expectations that you had for yourself or for your care team or for the care providers is a great way to celebrate your accomplishments and to reflect on any challenges that you might have faced. So this reflection can actually allow you to reconcile any disappointment or goals that you may have had for that birth or then for a future birth to come. So as a birth doula, I really enjoy keeping detailed notes for my clients during their birth. And then I actually write out a birth story from my perspective for the parent. And this is really helpful for them as they go on to write their own personal stories also, and as they think about what occurred and how they might plan for their next future birth also. So there's so much that we can learn from birth about ourselves and even about our spouses in childbirth. Personally, I feel like each of my birth experiences got better, and I would even feel myself challenged to increase my enjoyment in each of the births of my children. My family is now complete at this point, but I think the only thing that I'd be super excited if I had another child was like, I think I could make it even better. So birth is exciting in that way, when we're learning about ourselves and how we can even change our future experiences as well. So I truly believe that traumatic birth experiences can be redeemed with the right support. If you've experienced a C-section, seeking out your options of a vaginal birth after cesarean or a VBAC is important. Because once a cesarean, always a cesarean is not always the case anymore. Even here in my rural area of Iowa, where our closest VBAC hospital used to be an hour and a half away, women were not always given their options to choose a VBAC for themselves. Although recently we have a hospital just 45 minutes away that is now offering VBAC. And it's been exciting to see that one of our local doctors, in fact, has been sending all of her past cesarean patients to this new VBAC hospital to see if they are good candidates for a VBAC birth after cesarean. So if this is you, ask the question, find out all of your options. Be sure that you're making the best choice for you and your baby from the information and the resources available. You might be surprised. You might be a good candidate to have a vaginal delivery after cesarean. If you need help with this, feel free to contact one of your nearest Guiding Star centers, because we can help you to get into contact with available birth doulas or medical providers who can share with you the possible options that are available in your area. So where do we learn about birth? Where do we get these different thoughts or ideas about what birth actually is? Well, of course, we learn a lot from media, family experiences, and friends. Most moms love sharing their birth stories, but let's be honest, they're not always so very positive. You know, I always encourage my doula clients to create a good boundary when they're working towards and they're expecting towards birth, to create a good boundary when people offer to share their stories. If someone begins to share their story with you, stop them and ask, is this a positive story more than the fact that you have a live baby in your arms? Moms, don't share scary birth stories with expectant moms, but do share them with a counselor or a birth trauma group. Work through those different experiences with people. It's very important. Expectant moms, immerse yourselves in good, positive birth stories and guard yourselves against negative stories as you prepare for the mental capacity as you prepare for your birth. As I prepared for this webinar, I wondered what the most common words people would use to describe birth. So on Facebook, I posted this photo or image, and I said, please comment 3 words that you would use to describe childbirth. While I expected to hear more negative words, I was actually pleasantly surprised that there were a majority of positive words used. Now, I'm not quite sure if this was due to the fact that it was posted on social media and the type of words people want to choose. They know people are going to read, or what people might think about them for the words they choose, or the fact that they were my friends or some of my doula clients. But it was interesting that the most common words were scary or terrifying, and along with empowering. So very, very positive word of empowering, and of course negative words on scary and terrifying. The response that broke my heart the most was a friend who has no children, and her response was, don't do it. That really hurt. I thought, wow, you know, that's the type of thoughts or images that are being given to some women who aren't even in the position of giving birth. So don't do it was her response. The word that I loved the most was fun. And I actually was with this woman for one of her births, and I hope that she was describing the birth that I experienced in supporting with her. I do believe that birth is fun. And as a birth doula, I have so much fun with my clients. I love birth, whether it's my children or my clients that are being born. Taking my body to its limits in birth, to birth my children, or supporting a mother in the empowering experience of childbirth, and then seeing their accomplishment with that newborn in their arms is the most gratifying moment for me in my work. Now, seriously, when we hear that more than 350,000 women die in pregnancy or giving birth each year, you can only wonder why fear is one of the biggest obstacles that keeps women from a natural experience of birth. In the U.S., it seems that our birth culture really needs some work. But how do we go from a culture of childbirth being scary and painful to an experience that is awaited for with positive expectation and joyful excitement? One of my favorite birth experts is May Gaskin, who is a midwife. May has a TED Talk that I share with every mother that I can. And in this TED Talk, she talks about how she read a book called Reducing Fear in Childbirth. And, it was called Childbirth Without Fear. And she explains that unbearable pain is associated with fear and under-preparation in pregnancy. She shares how birth needs to be safe and that women need to be in an environment that she feels comfortable and completely safe so that fear can't be there and so that she can feel empowered to do what she's intended to do. One of my favorite quotes that May shares is, "Your body is not a lemon, and give birth a chance." So many women think that their body is going to fail them, or they may have even been told that their body has failed them. Maybe it even has taken them a long time to conceive anyway, but they oftentimes are not even able to give their bodies a chance to birth naturally. Another term you hear around our Guiding Star Centers is new feminism. And to me, childbirth in a new feminist is a woman feeling free to pick her birthing location, her support team, and to be fully supported in whatever and however much time she feels her body needs to birth her baby. I believe we can prepare for a natural childbirth and accomplish our goals. To accomplish a natural childbirth, I think that there's a few areas that we can do to help, some keys, if you will. So the keys for natural childbirth preparation would be education, physical, mental, and emotional preparedness, time, and a support team. So with education, if you commit to educating yourself about birth, women can actually get good education about their bodies, work, and how they work and how they process and how the childbirth process works. I believe that this type of education should begin early. If young women grow up learning and celebrating their natural feminine qualities, I truly believe that our birth culture will change drastically. Teaching women about their natural abilities of women to give birth and for all of their birth options allows her to make the best choices and to actually prepare for the birth with good, positive understanding before allowing fear to take over. When a woman has a thorough understanding of her abilities and the birth process, she'll feel confident in her birthing abilities as well. As we prepare physically, mentally, emotionally, physical fitness in pregnancy is so important. We are preparing for a marathon with childbirth, and so it's important that we prepare well and that we train well. There's also a need to nourish our bodies and our growing babies well so that we can reduce our risks of complications that might keep us from having a natural birth. A method that many of my clients use in the physical area of being prepared is spinning babies. Many of our clients like to use this technique because it allows them to learn exercises for optimal baby positioning. When we learn about how the baby's position affects our comfort in pregnancy and our progression in labor, most would wonder why all women aren't taught this information as they prepare for birth. At Guiding Star Orange City, we actually now offer the official Spinning Babies parent class. And so our birth educator, Amaris, she comes and she teaches this class in a way that parents can move forward and have great skills in changing the position of their baby throughout pregnancy and throughout labor and delivery. So this class is also available through video format, and you can check that out. You can actually purchase it at the spinningbabies.com website as well. But talk to your care provider about appropriate exercises for you during your pregnancy. And most importantly, just stay active during pregnancy as you need the endurance for a natural childbirth. Preparing mentally is very important. All of the things that we hear or learn about birth from a view of what we can accomplish in our own experiences. There are many images and misconceptions out there about birth, and we need to reprogram our brains in order to accomplish positive affirmations towards natural childbirth. So a good way to do this is by first setting those boundaries like I was talking about for the information that we're going to let into our minds during pregnancy. Reading many positive birth stories is helpful in this ahead of your birth, and also being able to begin telling yourself that you can do this, that millions of others have done this too. And this is basically was my main method as I was preparing for my the first birth of my first child. I just knew, like, so many millions of women have done this before me. I'm sure I can do it. It's not going to be too bad. And so I didn't do a lot of heavy education and learning about different methods or anything like that. I just went in telling myself, I can do this. It's going to be all right. So that's very important, just to bring that to our mind. And also, many women use birth affirmations, positive statements about themselves and their abilities and their birth throughout pregnancy, labor, and delivery. So writing out some of these affirmations or truths to read to yourself and say out loud daily is a great way to prepare mentally. Then in labor, when things get intense, we can bring these affirmations forward and you will believe that they are true, that we can do it. Next, preparing emotionally is important. Healing from past hurts or abuse is very important for women approaching birth. Past physical or mental abuse or any past traumatic experiences can be triggered in a birth situation. Good counseling and therapy may be needed in order to help the mother prepare for the raw vulnerability in birth, and especially in a birth in a medical facility when physical touch of caregivers that maybe don't even know the woman very well might occur. So also remembering that in natural birth, the hormone oxytocin rises when the mother feels safe and secure. So oxytocin is that key to the progression in labor. So we don't want fear in the room. Fear works in the opposite way, and it doesn't allow the mother to progress through labor easily. So we need to combat that fear with the positive affirmations that we can do this. So time is so crucial. Women should be given all the time that they need to birth their child. As long as the baby and the mom are responding fine and the heartbeats are good and things are looking well, childbirth is not a race. Some babies take longer to birth and as they prepare to get into just that right position to exit. So when we put time constraints on a birthing woman, she tenses up and feels defeated. She doesn't meet the time requirement that's being given to her or put upon her. Also, a good support team. So assembling a birth team, choosing your care provider, choosing your birthing location are very important. When a woman feels fully supported, physically, emotionally, and with the information that she needs, she can feel very empowered in birth, and she sees wonderful outcomes. So we need to know all of our birth options. No one doctor or midwife has all of the options and all of the personality skills and that match every woman. So we're all unique, and we have choices in who we choose to support us in birth. I always encourage women to seek out a few different options for their care providers. If you're committed to a natural childbirth, one of the most important choices to make is your care provider and being sure that they're going to help you to accomplish your goal. If you don't have a sense that your care provider is going to support you in all that you desire for your birth, then keep shopping till you find exactly what you want and what you're looking for. When you're looking for your care provider, there's two different management or care techniques that are oftentimes used, and those are the expectant management and active management. Simply, active management is doing something to everyone regardless of the circumstances, whereas expectant management is waiting to see if something is necessary and using it only if it's necessary. So this is an example. Midwifery model tends to be more on the expectant care camp. So in this example, Pitocin is a medication that's used often to treat hemorrhage after the birth of a baby. So an expectant care provider would have this medication on hand and administer it if it's needed, whereas a provider with active management technique would give the Pitocin to every woman who delivers a baby because she may have a hemorrhage. This was a practice that I was completely unaware of as I was birthing my first baby in the hospital. I had just accomplished a completely natural birth, and the doctor was then administering Pitocin medication. I didn't fully understand why, and we didn't really have a chance to make a choice or ask for more information to make a different decision. So navigating these types of questions and finding the best support team for your birth can be sometimes difficult, but there is help available. So after the birth of my second child, I had a couple who asked me if there were any birth doulas in the area. And at this point, I actually didn't even know what a birth doula was. This was in 2015. And I went to look into what a birth doula was, and I realized that I actually had the skills and interest that I needed to begin training to be a birth doula. So as I began training, I was able to begin supporting couples in birth, and I was able to support that couple and then 14 others since that time. So a birth or labor doula is a birth companion that is non-medical. So I guide couples in physical, emotional, and informational care. Doulas do not go off shift, and you have an opportunity to get to know your doula well ahead of time and to plan out your goals and what you would have for your birth and for your baby. So I support my clients in getting all the information that they need to make the best choice for them so that they may dream and plan for what they would like in their birth. Now, not every couple who hires a doula has the goal of a natural birth, but a couple does have a greater chance of accomplishing a natural birth with the support of a doula. So no matter the birth location or type of medical care provider, doulas are able to offer a variety of natural pain management techniques. We use movement, we use water, massage, relaxation, and my favorite, distraction. One of my favorite parts of being a doula is encouraging the dad to support the mom as much as he possibly can, and then being able to give him the ability to take breaks when he needs to. So doulas actually support their clients with the understanding of discomfort versus chronic pain. So natural childbirth is not a chronic pain issue. I like to describe it as a purposeful discomfort that has breaks in between contractions. And believe it or not, there are many women who have been able to prepare and experience childbirth completely without pain. That's not me, but there are many women who have been able to do so. My first two children were born through a natural as possible hospital birth without a doula. And I had no understanding of what a doula was, nor did I have an option for that type of support. My third child, unfortunately, died at 6-week gestation, and I gave birth at home at around 11 weeks with a medical induction. This birth was a very difficult event, even though I had just finished training as a bereavement doula as well. If you missed Laura's webinar on pregnancy and infant loss, please go back and watch that replay, as she explains some of the options that women actually have in bereavement birth as well. I find it an honor to walk with families as a bereavement doula in the difficult type of birth where the experience of that birth is still very important, even as it is with a happy birth, a live child. Now, my fourth baby was born in the same hospital with my same wonderful care provider, but this time I had a doula as well. It was so wonderful to be cared for in such a gentle way and have the opportunity to be cared for in the same way that I care for all of my clients in birth. As our family is now complete, I was so very happy to have my final personal birth experience fully supported and in a beautiful way of completing my childbearing time with our rainbow baby. And this final birthing experience was able to redeem the difficult bereavement birth that I had experienced just a couple of years ago. So here at Guiding Star Orange City, we have 2 certified birth doulas. And then now we actually have 4 birth doula interns in training. So if you're interested in hiring a birth doula, then contact your local Guiding Star Center, because you'll find that they have connections with several different birth doulas. And again, just like a medical provider, not every birth doula is going to be the best fit for every woman. So it's important to shop around or interview and get to know them and know, is this the type of person that's going to be a good fit for my birth team? So all in all, give birth a chance. Give yourself a chance. If you desire and commit to a natural childbirth, it will take some hard work, but you can do it. We are made to do it. With the needed education, preparation, support, and time, women can feel empowered to birth well. So I have a few resources to leave you with, some of them that I had mentioned. SpinningBabies.com is a great website to go to prepare for your birth, or even if you're having an issue in labor, you can actually go to this website and there's some great techniques there. But I do highly recommend that you attend a parent class to be able to learn these techniques well, or to hire a doula who knows them well to work along with you. May Gaskin, as I mentioned, is my favorite midwife. She has a lot of amazing books that you can read, especially Guide to Childbirth. And I also recommend her TED Talk that you can find on YouTube. Natural Hospital Birth is a wonderful book as well by Cynthia Gabriel. Evidence-Based Birth.com is a great website to go to as well, with many different topics that have been researched by a registered nurse. And I think they've covered almost every topic that I can think of that come up that people have major questions about, or things that they want to find out more information on different situations for them. Also, contact your local Guiding Star Center for resources for childbirth education, different care providers in your area and referrals for them, and doulas and extra support. Okay, so if you are an expectant mom, please consider a natural birth for you and your baby. Consider what time and the information and support that you need to accomplish your goal, and contact us for support as you prepare. We'd love to help you. So thank you so much.
Thank you very much. So those of you who did here, if you have questions, please feel free to type them into the question box. on the page. You can go ahead and do that. I have just a personal question to come back with. My mother had 6 children, all natural childbirth, and she swears up and down by the Lamaze method. And I was just wondering about your thoughts on that, and if you have ever used that before, or what kind of methods you like to help your clients to prepare for having natural childbirth.
Yeah, Lamaze is one of many methods. There's hypnobirthing and all of these different ones. And truly, I think that any method that you choose that helps you in relaxation and focus is going to help you to accomplish your goal of a natural birth. I don't have special certification in these different methods, except for the spinning babies. I did attend a workshop, and then our birth educator, Amaris, is a certified teacher for spinning babies. But truly, like, our clients come with all different things. But what I've really come to find is that even when we don't coach breathing or teach people how to do different things, and we just bring it from the core of like who women are and encouraging them that they have all that they need within them to birth their babies, we just see wonderful outcomes, But I think any method that you choose is going to be helpful because it's going to help you to focus, and it's going to give you relaxation techniques to be able to pull out when things get intense in labor. So yes, I'm sure your mother had wonderful experiences with all of those births. That's great.
Great, yeah, thank you. Another question here. My baby was 2 weeks overdue and was starting to show signs of distress, so I was given Pitocin to accelerate labor. Have you worked with someone who experienced that, and how can you still go forward with as natural a childbirth as you can?
Yes, I've attended many births that have started with induction. And the hard part is that when our labor doesn't start spontaneously, we are already introducing a synthetic form of Pitocin, which is trying to mock what oxytocin does in our bodies. So we already start off with our bodies not yet being ready for going into birth. So we can have as natural as possible. We can have a vaginal birth still, obviously, but it is usually a little bit more difficult, and it does take extra support. I've seen several of my clients who have started with an induction go all the way through without an epidural or any other pain medication. But then I've seen also many that have started with the intervention of induction and have needed to have extra support with pain medication or epidural because it's gone so long. One thing I really want every woman to hear that has ever gone through an induction and has had difficulty or has had interventions and extra things or even ended in a C-section, you might have heard the term failure to progress. And I want each of these women to know that you did not fail. The induction failed. Your body wasn't yet ready to do what it wanted to do. And so this medical intervention failed in what it was supposed to do. And that's important for us to realize. Just like May Gaskin was saying, your body is not a lemon. We don't have one, oh, your body doesn't work. Your body can't birth babies. Like that's not how it is. It's a very rare case that we have even a pelvis size that can't birth a baby, So we have to remember that and know that like our bodies can do it. So for this woman, your question about, starting with an induction that time, that doesn't mean that in a future birth that you'll have to have an induction again. And also working with your care provider on, is it actually absolutely necessary to induce or not is very important. and having a care provider that will allow you to go as long as possible that your body needs. But of course, when a baby is feeling distressed, there's things that you have to make decisions with your care provider as well. So yes, those decisions are difficult. And that's when we're very thankful that we do have medical help to keep our babies healthy when they are showing distress in that way. Mm-hmm.
Great, thanks, Kari. There's one more question that has come in so far, and that is, I had a cesarean section for my first birth, and I would like to try for a VBAC for my second. What would you recommend to help me with those fears of having a second C-section while I'm trying to go for a natural birth?
Yeah, I think some of the things that I shared in the webinar as far as, writing out your birth story. What were the reasons that the C-section happened? And then together with your care provider, finding out, am I a good candidate for VBAC? And if you find a provider that says, yes, you are a good candidate, then I highly recommend hiring a doula, because a doula will then be able to be there step by step with you all the way through, and they can know ahead of time what the different fears and triggers for you will be, so that when those intense times come in labor, that they can support you fully in that time. Whereas, you're kind of in the luck of the draw with your labor nurses, because you don't know who they will be. Oftentimes we know like our doctor will be there, but they're not usually there very much during the labor. Some people are lucky if they'll be there most of the time, or a midwife is there kind of more. But if you don't know who's going to be there to fully support you in those times, then that can be difficult. So a labor doula will actually be there with you the entire time, so you can be assured that, okay, when those fears come up or those triggers come up of the same situation maybe that happened in your prior birth, they'll know about it, and they'll be able to help you make it through that experience. So anyone who is trying to go for a VBAC, I would highly recommend making sure that your birth team is solid and that you've got a good doula on board, and your husband or partner is going to be really important in that as well, because he probably experienced a lot of that fear right along with you. So it does take some extra work to prepare for and support that you're going to need during that time. But it is so possible and so worth it if you are a good candidate for a VBAC.
Thank you so much, Kari, for sharing with us your experience and wisdom that you have gained from doing this. Is there anything that you would like to add before we close out the webinar?
No, thank you so much for this opportunity. And if anyone would like to contact me for further questions that you have, feel free to. You can find me on Facebook at doula Kari Beadner. We also have a doulas of Guiding Star Orange City, where you can contact the different doulas in this small little corner of Northwest Iowa. But reach out to your Guiding Star centers or other doula agencies in your area to find out more information. It's a great experience. I'm so glad that I was able to have a doula in my last birth. It was a dramatic difference. So blessings to all of you who are expecting and preparing for your birth. I hope that some of you would be empowered and encouraged today to give yourself a chance and give birth a chance.
Thank you very much, Kari, and thank you everyone for listening in. Have a wonderful evening.